National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopathic doctor and a health expert here at Nationalnutrition.ca. Today, I want to talk to you about what we call a repetitive stress injury known as Carpal Tunnel Syndrome, or CTS for short. Carpal Tunnel Syndrome, it's very common in people that work in offices, especially if you have a lot of computer use, because of a compression of a nerve through what we call the carpal tunnel. So first, a little bit of anatomy. The carpal tunnel is a small tunnel in the wrist where your major arteries, veins, and nerves run that innervate and feed the hand. When you have carpal tunnel syndrome, what's happening is you're getting compression of this small little tunnel into the hand, and that's interfering with normal blood flow and normal nerve function of those nerves. Now, carpal tunnel syndrome, often it can be characterized by weakness in the hand. You may have numbness, pain, tingling in the hand, but it doesn't just occur in the hand. The thing is, the nerve that is affected in the carpal tunnel runs all the way down the arm up into the neck. So you can actually experience carpal tunnel syndrome as elbow pain, shoulder pain, and sometimes even neck pain that's all radiating along the nerve pathway from the wrist all the way back up to where the nerve exits the neck. So, there's a variety of times where people get misdiagnosed as having a shoulder problem that in actuality can be carpal tunnel syndrome. Sometimes I've seen people diagnosed with elbow disorders. Again, not actually an elbow disorder, but carpal tunnel syndrome. Some of the main reasons you can get it, actually wearing a wristwatch where if you put pressure on the band of the watch, it pushes against the carpal tunnel, thus compressing it, damaging the arteries, damaging the nerve, causing then rebound swelling, which further narrows that little carpal tunnel, causing again the symptoms of carpal tunnel syndrome. So why do we call it a syndrome? Well, a syndrome is a collection of symptoms. You don't have to have the pain. You don't necessarily have to have the numbness for it to affect you. Your only symptom might be a little bit of weakness. Your only symptom might be, a weird feeling in your shoulder, or sometimes, you get easily fatigued when typing. Those can all be symptoms of chronic carpal tunnel syndrome. What can you do? Well, there's a number of different ways to treat it. When it becomes really chronic, sometimes you need to go as severe as a special brace, which holds your hand in the correct position that reduces any type of compression on the carpal tunnel and reduces the chances that you're going to get any type of trauma to the carpal tunnel. One of the easiest ways to try and diagnose if you have carpal tunnel is to simply put your wrists back or your hands back to back, bend your wrists down as far as they can go, and if you hold this position for 30 seconds and you develop pain, there's very likely a chance that you might have carpal tunnel syndrome. Another way is your doctor can actually take their little reflex hammer and tap you repeatedly on the carpal tunnel, and if you start to develop pain from repeated taps to the carpal tunnel, that may in actuality be a good diagnostic sign that you have carpal tunnel syndrome. Ways to treat it, as I mentioned, special braces are available. Ergonomics is very important. If you have to use a computer a lot, the way in which you use your mouse and your keyboard can dictate whether you're going to develop carpal tunnel syndrome. So there are special keyboards, special wrist braces, and wrist pads developed to reduce any type of trauma and pressure on the carpal tunnel, thus reducing the disease. As well, anti-inflammatories can be effective, especially if you've developed some inflammation now in the carpal tunnel. Reducing that swelling, reducing the inflammation, it takes the compression off the nerve, thus reducing the symptoms and allowing that area to heal. So those are a couple of things you can do to identify if you do have carpal tunnel syndrome. And if you do, there's a few helpful hints to help manage the condition. Check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.